Okay, so hello everyone. My name is Miss Sam. I am one of the teen librarians here at the Levittown Public Library. And today we are honored to have Melody Sun with us, who is a pharmacist. And she's going to talk to us all about how she became a pharmacist, what she's doing, what area of health she works in, and tell us all about it. So I'm going to kick it over to you, Melody. If you could just give us a little introduction, tell us about yourself and what exactly you are doing right now.
Okay, so hi everyone. My name is Melody Sun. I am a pharmacist and also serving with the United States Public Health Service right now at the Immigration and Customs Enforcement Detention Center. So I've been a pharmacist for 5 years, so coming up on 6 years. So my background with pharmacy really started in undergrad as a biology major. And I was fortunate enough to secure an internship with the government, which I had the opportunity to work closely with one of the public health service pharmacists. So that's how I learned about the commission core, the service, and also what pharmacists can do on a daily job. So I was also, I recently transferred to the ICE facility. I've been a pharmacist for 4.5 years, serving at the Indian Health Service in the heart of Navajo Nation in Arizona. So just give you a brief introduction to how I got here. Yeah.
Great. So obviously, working within public health is a little bit different than working, say, at like a CVS pharmacy or something like that. So could you talk to us a little bit about kind of how that differs and kind of what your day-to-day kind of looks like?
Okay. So I had I worked throughout my pharmacy school years as a pharmacy intern. So shortly after I graduated, I actually worked for Rite Aid Pharmacy, which is, your traditional brick and mortar store as a pharmacist. So there's a huge difference in terms of where, depending on your work setting, of course, but usually your retail setting, you are more worried about, processing the prescription order as they come to your pharmacy, and then really do a verification against the doctor or prescriber's orders against what you have in front of you. So during my IHS time or Indian Health Service time, we were kind of working like a healthcare team. So with the modern changes in, healthcare, right now in the hospital especially, they are divided into inpatient service as well as outpatient services. So at the Indian Health Service hospital, I was fortunate enough to participate in a lot of ambulatory care clinics. So those means your pharmacist can also become a clinician or a provider. So on a typical day where I spend my day at the diabetes clinic, I do have a scheduled list of people or patients that come to my clinic. On average, I would spend 30 minutes up to 40 minutes with the patient, spending some time one-on-one education, doing some point of care testing. Simply means, grabbing a glucometer and then download their data or have them prick their fingers at the site at the visit. We were able to order a lot of laboratory values, and based on the clinical assessment of how one's sugar is controlled, as a pharmacist, we can make changes to their medications, such as insulin or all the oral diabetic meds, and et cetera, et cetera. So on the inpatient side, you were exposed to a variety of inpatient medications, a lot of IV intravenous medications to really help the critically ill patients. And then right now with my role at a nice detention facility, so it's changed a little bit. So right now at my setting is more primary care or chronic care focused rather than inpatient critical care. So those are some different areas as a pharmacist where you can commonly see a pharmacist work. Either it's outside hospital, they can become an inpatient or clinical pharmacist, or they could become an ambulatory care clinic focused with one disease state or multiple disease states. Or you can have your retail, you do your daily verification, filling out the prescriptions.
That's great. I think it's wonderful that, it's not just what you would typically think of as a pharmacist in a
Right.
pharmacy, that there's so many different areas that you can go into. And it really is a broad career spectrum, depending on which path you decide to take.
Correct.
So I know you talked a little bit about, your education and then, going into interning. So I know you said you started as a biology major. So
Yes.
obviously, whenever we're talking about teens being interested in a career, obviously the college path or any type of certification path is kind of our first stop. So could you talk to us a little bit about your education? Are there certain classes or majors that they should definitely be going into? Kind of a little bit about that.
So I started out with a biology major. So I do have a bachelor degree in biology. It's just general biology as an undergrad. So there are certain prerequisite or requirement classes you do need to take before you get your admission or admitted to the pharmacy school or in any other health professional schools. So for pharmacy in particular, you do have to have a background in chemistry and also biology, math, statistics, communication. Those are just among the basic science or writing classes that you would expect to have before you can submit your application to the pharmacy school. So I would suggest for high school students who are interested in exploring more towards the professional degrees to look at the school of your interest, because most of the schools on their website, they would give you what they need, a list of requirement or credits they accept into their pharmacy school. So in the United States, as of today, so I believe most of the pharmacy schools, they issue a doctor of pharmacy degree. So that has been the mainstream pharmacy degree. It used to be you just need to simply obtain a bachelor degree in biology, in pharmacy sciences. So you would have, that's why you see a lot of pharmacists that has a BS. RPH stands for registered pharmacist degree after a pharmacist's name. But it seems like with the whole industry has moved, the current trends, and it's trending towards more clinical, more involvement from the pharmacy side as a provider. So with that, I highly recommend you explore the school of your interest and look at their website, maybe jot down on the list of requirements they have to admit to pharmacy school. Besides the degree, you have to have certain schools, they require to have a bachelor degree before you actually can get into the pharmacy school. Sometimes you also have to take an exam that's called a PCAT, or pharmacy, I believe it stands for pharmacy admission, pharmacy college admission test. Don't quote me on that, but it is the standardized professional exam to basically test your standard knowledge of math, sciences, and things like that, which will be required from you during pharmacy school years.
Gotcha. And then when you come out of pharmacy school and you have the doctorate, is there any specific licensing that you need to get after that, or is it just the degree then from the pharmacy college that is required?
Yes, so after you graduate, so pharmacy school is usually 4 years postgraduate for most of the pharmacy schools. So that means you would have to get a degree from a college with a bachelor degree. So that's 4 years. And then pharmacy school will be typically runs from 3 years to 4 years. So most of the schools will have 4 years of curriculum. So after you obtain your Doctor of Pharmacy degree, you do actually have to pass a licensure exam. That is, specific to state. Each state has a slightly different requirements. So I'm licensed with the state of Maryland as a practicing licensed pharmacist. So I do have to sit for the board examination, which is standardized across the nation. It's for, I believe it's just a general pharmacy board examination. However, there's a second exam you do have to pass, which is specific to the state laws. So for me, I do have to sit for the pharmacy law section from the Maryland state. So once you pass both of the exams, then you will become a license. You will get your pharmacy license, and then you have the authority to practice pharmacy in the state of Maryland or any other state of your choice.
Gotcha. So that actually leads nicely into my next question, which was about, traveling or moving from one state to another. Obviously, you were just saying that there are different licensing requirements, for each state. So would you say that, there are certain areas that are better to work in than others? Or is it really just, the opportunities are endless and it just depends on each state's specific requirements?
So I would say the opportunities are endless in terms of professional pharmacy. It really depends on where your interests lie. So like I said, you can work in the industry, working for a pharmaceutical company. If that's something you're interested in, working on vaccines or new drugs. Or if you're interested, like me, I work for the federal government. So if you do choose a career as a pharmacist working for the federal government, you're actually exempt to obtain another state license, even though if you're practicing in another state. So for example, I am located right now in Tacoma, Washington. So I do not hold a Washington state pharmacy license. However, I do hold a valid Maryland state license because I work for the federal government. To a certain degree, it exempts you to have, pay the fees and transfer your license to another state. So which is a really nice thing in terms of, career choices, because with that, I can, feel free to move to a different state if it's, as long as it's within the same federal government system. It's really endless, depending on where your interest lies. If you really, really highly like the clinical aspect of pharmacy, you have opportunities to go into more specified fields such as oncology pharmacy or geriatric pharmacy, pediatric pharmacy. Which all requires residencies, trainings after you obtain your license as a pharmacist. And also most schools or hospitals, they do have residency applications. So you have to apply that separately.
Gotcha. And then specifically with your job working in public health, do you travel much for your job, or are you just at one location, a day in and day out?
So, at my current role, working for Immigration and Custom Enforcement, I would say all the U.S. Public health service, doesn't matter whether you're a dentist, you're a doctor, you are a nurse or a pharmacist, we all kind of hold two jobs. So, we have our day job as, whatever profession you are. So for me, I am also a pharmacist, but then you're also wearing another hat or working another job as the public health officer. So you are uniformed services. So in a certain degree, it behaves kind of like a military. So in case of, national crisis or like hurricane hits, there's the infrastructure or other critical services to the community are interrupted. So you may get called upon to deploy or do a temporary duty assignment to help out in the areas of need. Okay. So it really depends on, where you work, your agency, and what kind of nature or profession you are. And if you join the United States Public Health Service, you have the opportunity to be called upon to help the nation in need.
That's amazing. Yeah. And that actually also leads into my next question, which is obviously, with the current state of your job, you could be deployed into a national emergency or something like that. So would you say that there are any limitations to your personal or social life, due to the nature of your job?
So I believe that deployment is always hard. It's most likely some of the deployments are more, you get noticed, in a couple weeks in advance leading up to your deployment. However, most of the nature of the deployment or temporary duty assignments are unannounced, or so typically we do get a notice of being deployed a couple days. So in my last of deployment assignment, so I was notified actually on the day of my deployment. So that was, definitely give me a little bit difficulty in terms of getting to the airport, because mind you, I was located in the heart of Navajo Nation, which is a really remote, underserved area. The nearest airport was located 2.5 hours away from me. So once I get the order, I've been activated and called upon to deploy, I really have to, pack up my, to go bag, and then, throw on my uniforms, all the essentials I would need. I do have a pet, a dog too. So, that can sometimes bring a little bit difficulty to my life because I don't have a pet sitter at home. So I have to, make sure I board her or drop her off to my friends and things like that. So if you're considering a public health service as your future career, so those are some potential obstacles or hurdles you need to do take into consideration. I was a single, person joining the public health service, a young pharmacist. So I didn't really have a lot of obligations compared to someone who is already, starting a family or already having kids and pets, people that you need to care for. So, those are some considerations to think when you are thinking about a career in the public health service, because you do have opportunities to be, deployed.
Yeah, absolutely. Yeah, just definitely things to keep in mind, when considering what you're looking to do. So I know another thing that we talked about was, I guess it kind of goes along with the deployment option and things like that too. Obviously, your job assignment could change very drastically, very quickly. So how do you, are you required to take continuing education throughout your career? How do you stay on top of, different situations or different medicines? Obviously, medicine is constantly updating and changing. How do you stay on top of those things?
So one of the biggest reasons why I chose pharmacy as my career is really, the drive or the need to stay active learning throughout the rest of your life. Because, new medications, I would say hundreds and thousands of them, new medications come out every single day. And also in terms of treating a disease, the clinical guidelines are constantly changing. Let's just take COVID again, for example. The pandemic is ongoing. There is still a lot of research that's being done, and as they complete, new evidence will be released. So that really requires you to have to develop a habit of self-learning, proactive learning, as well as trying to stay on top of things, because you are in a practical profession. So that way, every aspect of your professional life as a pharmacist, it does involve some clinical knowledge or administrative knowledge updates throughout your career. So as in terms of for the requirements as a pharmacist, you are, so I'll just take the state of Maryland, for example. So the state, they all have a certain number of CEs or continuing education credits you need to obtain during a period of time. So for I renew my license every 2 years. So that requires you to obtain 30 credits of CE credits during the 2 years. And then most of them, if you look at the Board of Pharmacy licensure homepage or website, they will specify among the 30 credits that say 2 of them are required on, for example, immunization. 1 will be required on birth control prescribing, because the pharmacists in some states are authorized to prescribe birth control. So you need to stay on top of that. So it varies slightly from state to state, but just for the minimum requirement to stay as a practicing licensed pharmacist, you do have to obtain a certain number of CE credits during the period. I also hold a pharmacotherapy board certification. So it has a lot of weight. It adds a lot of weight to my pharmacy practice. So with that, it enables me to stay on top of most of the clinical guidelines on treating various disease statements, taking care of critically ill patients in the inpatient setting. So in order to obtain or, to hold my board certification that renews every 7 years, I do have to obtain 120 CE credits. So it all really depends on how much or how willing you wanted to do. Let's say if you hold more board certification, the general rule is, the expectation is that you have to obtain, proportional CEs to continue or hold your license and also certifications.
Right. Well, that absolutely makes sense. Yeah. And then another thing that I like to talk about too is obviously, with the rise of the pandemic and things, technology has definitely taken a bigger hold in our lives, especially like with Zoom and things like that. So how has technology changed within your job? Are there any things changing that you foresee in the future, or anything that just people should be aware of?
I think technology has certainly changed everyone's lives, but what I've noticed is, I was a pharmacist working on the front line during the pandemic at the hospital, taking care of ICU patients and also inpatient, just really critical EO patients. So I would say for most of the generally speaking, for most of the medical professions, you do use technology to help your job, but it's kind of like you have to be there and to do the job, because you have to assess your patients in person. Although technology can help, or can speed up the telemedicine degree to a certain aspect, but in terms of pharmacy practice, I do believe we will still stay as a traditional mode in terms of pharmacists being on site somewhere, actually physically looking at the medication, making sure everything's good, making the IVs, and then making sure the dosage that goes into the IV bag is appropriate, is correct. So those are, the nature of the job is really depends. However, I'm also getting a degree in computers or informatics. So with that, I hope that I could involved with IT projects. So, certainly rely more on computer technology to help me look at the data trends and to identify, medication trend or disease patterns, things like that. So if that's something in your interest, then you can definitely, work from home, especially during the pandemic, because most of that job is required you of like looking at some data and perform analysis. So that does not require like clinician interactions, or doesn't require you to interact with your patients.
Great. And that leads very nicely into my next question, which was about, obviously, we've talked about how you hold several different certifications and you're looking to get another degree. So can you talk a little bit about the opportunities for advancement? It sounds like there's very many different opportunities. So how would you say that works within your field?
So it's typically for a traditional pharmacist, if you wanted to start off with your retail pharmacy. So most of their structures work like, you would start off with, they offer you a job as maybe a staff pharmacist first. And then once you, handles that and do a really good job at handling the local pharmacy, managing the business side of it, you will be likely promoted to the pharmacy manager. And then the next advancement is going to be the district manager. Maybe you're so good at what you do, you get promoted, and then you kind of oversee several stores in that region. And then potentially you can go through the corporate ladder to become, the VP of the organization. So that's typically your retail, how that goes. In terms of inpatient pharmacy, it really depends. But, let's say if I wanted to go into inpatient, so that usually requires you to complete residency and then obtain a further board certification in something. Pharmacotherapy is a very general clinical pharmaceutical knowledge. You can obtain that just to be, knowing a little bit from different field. Or if you really, let's say you really like to work with, geriatric population, you wanted to get a board certification in geriatrics, then your focus will be slightly different. So, focusing on geriatric population or older adults population. So you probably most likely spend a lot of time looking at chronic disease management, a lot of multiple drugs interactions and disease drug interactions. And then from there, you can hopefully be promoted and to run the whole ambulatory care clinic all by yourself by a geriatric pharmacist. And if you do that really well, so it's not unheard of or not uncommon that some board certified pharmacists, they do have their own business of some sort.
Gotcha. And then I would think with health that this wouldn't apply, but are there any certain times of the year that are busier than others, or is it pretty much just a steady workflow throughout the entire year?
I would say in the hospital setting, we do see a kind of like a busy season starts to hit around fall into the winter time. Is just mainly because, given the patient population, there's a lot of elderly patients in, the Arizona rural communities. So in the winter times, there's, high or more likely that they will develop some kind of cardiovascular diseases during the winter times.
Mhm.
And then also because the Native American population, they like to travel, from places. In the winter, they all come back to the reservation and then to, stay home. And because of the snow, they couldn't travel more. So that's why we do see, we do identify the fall and winter season to become the more busy season. But it really depends on the nature of your work setting. I feel like retail, right now, given that the recent booster, requirement or booster option for, COVID-19 vaccine, Pfizer vaccine. So you do, have a lot of, you do get hit up with a lot of patient load when it comes to fall, because you also wanted to immunize the COVID-19, give the COVID-19 vaccination, or when the flu season hits, you wanted to offer those two. So that's kind of like adding on to your already busy workload. So it really depends.
Gotcha. Yeah, I didn't really think about it that way, but that's very interesting. I didn't think about that.
Yeah.
And then obviously we talked a little bit previously. I know you were saying like, especially like in the retail pharmacy, you're dealing with doctor's orders and things like that. So obviously I would think that this is a job that relies heavily on teamwork. Could you talk a little bit about, kind of what you do individually, what you do, how reliant you are working within a team, and how does that work?
So at my current site, I do rely a lot on my pharmacy technicians. So you do have help in the pharmacy. So pharmacist alone, you basically makes the final call in terms of verifying the orders. And then if there's any errors associated with the order, you have to take the initiative to contact the provider and hopefully get those corrected. However, healthcare is a teamwork, team play. So everybody kind of contribute to the, to bring a goal or common goal of bringing, the best healthcare that's available to the patient. So really, our jobs are pretty much clearly lined up, but the pharmacist is kind of like taking the ultimate responsibility for what is going on or happening at the pharmacy.
Gotcha.
Yeah.
And then what would you say is the best part of your job and some of the challenges?
I think looking back, I would say the best part of my job is really, I was fortunate enough to, start off my career in the retail and then transition into, kind of like an ambulatory care clinic and also inpatient setting. So I was fortunate to, to see different aspects of pharmacy practice. So I was exposed to that. So that way it really opened up my vision, because I can see, oh, pharmacists can do this and pharmacists can do that. You can also lead on project and then have opportunity to work with other healthcare providers. So I would consider that's the most fortunate aspect of my job, is the opportunity to continue explore, continue learning from various disciplines. I would say the less fortunate aspect of my job as a pharmacist is really, when you do get a lot of workload, especially during the pandemic, you do, it does really wear on you. So I could recall that during my busiest time working as an inpatient pharmacist, I do have to respond to, up to 3 medical codes or emergencies in one day. So those are, situations where you deal with life or death. You do have to see that, unfortunately, especially more prevalent during the pandemic. So I would say that. So this job is, I can say is pretty much associated with high level of stress. Doesn't really matter kind of which area you practice. So you do have to work hard to maintain a life-work balance, and then really try to find the best way to release stress.
Yeah, that makes a lot of sense.
Mhm.
And then can you just talk a little bit about, obviously I know we talked about in the program through college and stuff, there were internships and things like that. Is there anything that you could suggest for if someone is in high school right now and they're thinking about considering this as a future career, something that maybe they could be working on now while they're in high school to either improve their skills or to maybe look to reach out to certain things for internship or volunteer opportunities?
So I would suggest looking into the volunteer opportunities or at your local pharmacy to start out. Those are good starting points. So, I obviously did a lot of internship before I decided, oh, pharmacy is the career field I want to pursue a full-time, lifelong career in. Because I suggest that you really take the time to find out where your interests lie, and then just go to your, local pharmacy like CVS or Walgreens stores, and then just ask them to see if there's any opportunities to or the requirements to work as maybe like a pharmacy technician or just shadow a pharmacist for a day or two. There are also local charitable like clinics. That means, in most areas you can find ambulatory care clinics or, hospital emergency clinics that care for example, undocumented immigrants or for people who do not have insurance. So those clinics typically do offer opportunities for you to shadow or even volunteer your service. So, I would suggest go out there and explore, try to see if you can get an internship or shadow, a pharmacist for a day or two or up to a week, however it takes, so that way you can know what a typical day looks like. It may look different from pharmacist to pharmacist, but at least you'll get an idea, because, you wanted to make sure you choose a career field, 10 years down the road, and then you wouldn't hate that, making that choice.
Yeah.
So that's very important. So I think definitely getting the exposure, getting the experience or internship, volunteer, whatever it takes, to really expose yourself to that and see really firsthand to see how that profession works.
Yeah, I always suggest that with teens, that if there's something that you're interested in or thinking about, to at least explore it now, because at least it'll get you some ideas of whether this is something you really want to pursue or not.
Yes.
And then my very last question is, do you have any words of advice or any, last minute things, for teens who may be considering this as a potential career for them?
So I do think that overall, all professions are very interesting. It all really depends on where interests are. But I do believe with the current healthcare, United States has, spent a lot of proportion of our GDP on healthcare. However, in terms of infant mortality and also the quality of healthcare, compared to other developed world, we're still not, the top three. So that means there's a lot of room to work on in terms of the healthcare provider or professional. So, if you are not interested in becoming a pharmacist, but maybe a nurse or a nurse aide, things like that, I do highly suggest that you find a profession, or someone that, maybe your family friends, or, talk to your parents about it, see what they have to offer. See if you can set up a volunteer or shadowing experience with them. So that way you know what they do for living, and then really how their typical days are like. If you're interested in pursue a career in United States Public Health Service, we do have 2 student programs. One is called the Junior Co-Step program, and then that one is basically give you the opportunity to, to work in, for example, ICE, during the summertime, like school breaks. But with that, you have to kind of, in the midst of your professional study. So I did a junior co-step or student externship during my second year of pharmacy school. So I was fortunate enough to work on the policy side of it. So I saw, how the profession and how the public health service works. We do offer senior co-step, which is a program that pays for your last year of tuition in pharmacy school, but in turn you do have the obligation to serve with the public health service for in terms of 2 years to pay back. So those are some opportunities with the public health service, and we do have residency and various professions too. So if that's something that interests you, I can give out my information as well. I don't mind, setting up a time that we can chit chat about, just anything overall. If you're interested in pharmacy or what pharmacists can do, or what I do, what I did, opportunities to reach out. So I'm open for it.
Great. Well, I just want to say thank you again for sharing all of this wonderful knowledge. I mean, this has just been amazing. There's so many different opportunities that I didn't even realize. So, I mean, this has been amazing. So I just want to say thank you so much. And if anybody has any questions going further, they want to reach out to the teen department or to Melody directly, please feel free to email us at teens@levittownpl.org, and then we will share any of your questions and get those answers for you. So thank you so much, and I hope everyone has a great day.
Yeah, thank you so much for the opportunity. I hope you enjoy this conversation.